So this is just another way of looking at it. As your weight goes up, your risk of heart disease goes up. So this is your weight goes up, your risk of heart disease goes up. There are some people way down here that are these are the little tiny skinny people that barely eat. They're way down here. Their risk of dying actually goes up at the tail end there. When you're just so thin and fragile. And all of you have met people like that. But for the most part, the bigger you are, the harder you fall. So there are various different goals for weight loss. I kind of have my own opinion on this. I tell people the official kind of recommendation is that if you're significantly overweight, the goal is to lose 10% of your body weight in 6 months. That's hard to do. That's hard to do. Maximum you should lose is 2 pounds per week. I tell people if you're losing 2 pounds a month, you're doing good. If you lose 2 pounds a month, that's 24 pounds in a year. That's 48 pounds in 2 years. You're a different person 48 pounds lighter, as I'll show you. So if you expect to lose 10 pounds in the first month, you're just going to be disappointed at the end of the month. And it takes a while to get it going too. At the very least, prevent further weight gain. So if you're already overweight, at the very least, don't put on any more. And there's no magic to weight loss. There's no magic pill. There's lots of things they're working on that are magic pills to make you lose weight. But most of the things that have come out in the past have had some major problems with them. And it's really just a matter of how much you put in and how much you put out. And I think the biggest problem people have right now with weight gain and weight loss is the volume of food they're eating. They're not necessarily eating the wrong food now, because there's so many foods out there that are low fat nowadays. It's mainly just portion size. You go out and eat, and you go to a restaurant, and it's, they put the whole plate. If you're not taking food home, you're going to be disappointed, right? So going out to eat is a big problem for a lot of people, and just portion size is a big problem. And then there are some people that just don't move at all, and that's an issue. But just losing even a very modest amount of weight can have a tremendous effect on your cholesterol, your blood pressure, and your blood sugars. This is a study looking at just a weight loss of 10 pounds. And your cholesterol drops 8 points. 10-pound weight loss. Your blood pressure drops 5 points. Your blood sugars go down. So anyway, that's my little shtick on weight loss. Exercise, the more the better. There's really no limit that's too high. The recommendation for men is 30 minutes 3 times a week. The more the better. It's really, the emphasis should really be on the amount, not the intensity, so you don't have to run. Walking's fine. The latest recommendation is for women, again, unfairly treated, that you should get an hour of exercise 3 days a week. Longer than men. But you know what? If you can get 30 minutes 3 days a week, you're doing good. You're doing better than most Americans. And it doesn't have to necessarily be scheduled activity. So a lot of people think they got to be on a treadmill, they got to be jogging, they got to be swimming. Well, you can do some simple things. Just take the stairs at work. That's what I do. I walk 50 flights of stairs a day, it seems like. Walking for errands. If you go to the store, it's a quarter mile away, walk to the store instead of driving a quarter mile or half a mile. Park at the far end of the parking lot instead of drive around to get the very closest little parking spot. And then who's it does this? American Heart Association does this 10,000 steps campaign thing, where they have these little clickers, and I think we used to have some at these talks, these little clickers that measure how many steps you take in a day. And their recommendation is that everybody should try to get 10,000 steps, which sounds like a lot, but it doesn't take long to get there. Can I tell my story about my son? I'll tell you my story about my son. So my son's 8 years old, and I have several of these clickers I've gotten from various talks where they'd had them. I brought one home one time, and I get home from work, and my son, who at the time was like 6, runs up to me and said, Dad, I ran 3,000 miles today. And it turned out he ran 3,000 little clicks, but it didn't take him that long. It took half an hour, 40 minutes to run around the house, 3,000 little clicks. He was very proud of himself. So anyway, exercise, the more the better. Diet, there's specific, other than just smaller portion size, there's some specific diet things that you can do specifically to help your cholesterol. These are kind of recommendations for dietary intakes of fats. So saturated fats, those are kind of the bad ones. They're not the worst, but they're the second worst type of thing to eat as far as your cholesterol. They recommend it be less than 7% of your total calorie intake. They recommend less than 200 milligrams of cholesterol a day. Our nutritionist says you're allowed 4 eggs a week in there. And that the total fat should be about 30% of your calories for the day should be fat, which is quite a bit when I think about it. 30% of your food is fat. Avoid trans fatty acids at all costs. Those are the ones being banned in New York City and whatnot. Just have one slide on trans fatty acids. And then there are some things that are actually good dietary, there are things that you can do diet-wise to actually lower your cholesterol. So there is what are called plant sterols, and that's a type of butter that you can eat that actually lowers your cholesterol. And I have a slide on that. Fiber, so this is how, Quaker Oats or Cheerios says, hey, you can lower your cholesterol. There you go, is eating fiber actually kind of flushes cholesterol through your system faster so that you don't absorb it, and it can lower your cholesterol. And then there's omega-3 fatty acids, and I think I have a slide about that to lower your thing. So just one slide about the really, really bad fat, and that's trans fatty acids. These are the ones that are like banned in New York City restaurants and got a lot of press. And they really are bad. Interestingly, they're basically man-made fats. And they were designed to try to actually lower your cholesterol and improve our diet. And in fact, in the end, they make things worse. So the recommendation is that they only need 2% of your fat intake. The smaller, the better. And the reason they're so bad is that they not only raise your bad cholesterol, but they also lower your good cholesterol. They get you from both ends. And some examples of things are stick margarine. Has a lot of trans fatty acids. Cookies that you buy at the store. Not the ones that you make at home, but ones you buy at a store, a lot of trans fatty acid. Biscuits, white bread, and things like that you buy at a store often have a lot of trans fatty acids. And now most of the food labels have this on there, so you can look at it. So this is a therapeutic kind of fat that you can eat. It actually lowers your cholesterol, and that's the plant sterols. These are butters that you can buy over the counter. They sell them at any grocery store. They sell them at Fred Meyer, Hagen, and whatnot. They're a little bit more expensive than regular butter or margarine, not much, like an extra $1 per ton. And they can actually lower your cholesterol. They're sold under 3 brand names I'm aware of, which are Benecol, Take Control, and Smart Balance, and that's kind of what they look like. So that's the package. Like I said, you can buy in the store. If you're using to actually therapeutically lower your cholesterol, they recommend that you eat 3 pats of butter per day. The downside of that is its caloric intake. So it'll actually lower your cholesterol, but it's more calories, so you have to kind of balance that out with eating something less of something else. So that's the downside of these, but they do work. And so they're fairly effective. The older you are, the more they reduce your cholesterol. So most people in here are here above, right? It can lower your cholesterol by 21 points. That's pretty good. You're just eating some butter you sell at the store. And so this is kind of just the experiment that they did when they went to get this approved by the FDA for just general purpose over-the-counter kind of selling this stuff. They took people and they put them on this stuff, and this is their cholesterol drops down, then they took them off, and boom, it came back up. So it works.
The foods with the trans fatty acids,
yeah.
That's on the labels called partially hydrogenated, is that right?
Partially hydrogenated oils.
Like Crisco?
So, shaking head, yeah. I think so, yeah. So that's like partially hydrated oil. So they take regular oil and then they put hydrogen, add the hydrogen atoms on it to make it thicker and more of a solid.
And that's the same
it's like
thing as the trans fatty acid.
Crisco and stick margarine. That's what they do. They take oil that's a liquid at room temperature, and they add hydrogen atoms to it to make it a solid at room temperature, and that's how you get trans fatty acids. I'm pretty sure. That's going back to chemistry. That's a little far back.
How about lard? Is that
So lard is just pure, animal fat.
pure fat? Yeah.
And it actually doesn't have trans fatty acids in it, but it counts in your
Saturated?
saturated fat. Yeah, it's a big knock in your saturated fat. So olive oil, much better. Much better because it doesn't have as much saturated fat, it doesn't have any of the trans.
Walnut oil.
Huh?
Walnut oil, that's good. Walnut.
Walnut oil. Yes, I think that's all right too. Peanut oil, bad. What's it? Coconut oil, peanut oil, any of the hydrogenated oils. Those are all bad. So this is kind of just a summary of what you can do. Just diet alone, no prescription, no drugs at all. Low-fat diet, you can lower your cholesterol 12 points. Adding fiber to your diet. You know, I do Cheerios and skim milk. That's what I do. Lowers your cholesterol 8 points, and then these Sterol butters can lower it 16. So you can lower your cholesterol just with dietary measures by 30%, which is by not 30%, excuse me, 30 points. So that's different than percent. 30 points, but still, that's pretty good. So here's some things that are non-dietary, but non-prescription type things that you can do, things that are over the counter that you can get that also lower your cholesterol. Red rice yeast, and I'll talk a little bit about that in a second. Garlic, niacin, and fish oil. There's some other things out there theoretically, but these are the big ones. So just a little thing about garlic. Garlic is not very effective. It will lower your cholesterol by 2%, but it gives you garlic gas and garlic breath, and people, your friends start, stepping back a little bit for 2% lowering your cholesterol. It just ain't worth it. It's just not. It's not worth it. It's more hype than reality. Red rice yeast can be extremely effective. Red rice yeast is how statins were discovered. There are two types of red rice yeast. There's fermented red rice yeast and non-fermented red rice yeast. And there's a huge difference. The fermented red rice yeast is basically a statin drug. If you take fermented red rice yeast, just like the statin drugs, which we'll get into later, you need to have your liver checked 2 months after starting fermented red rice yeast. You need to have your liver checked every 6 months to a year after taking it, because it can cause liver abnormalities just like a statin can. It can cause muscle aches just like a statin can. And it's just like statins, it's actually quite effective in lowering your cholesterol. Unfortunately, because of the problems with the liver that it can cause, the FDA pulled it off the shelves in the United States. It was one of the first supplements that the FDA actually regulated and took off the shelves. And so all the red rice you can get now, like at Costco or at the health food store in the United States, is not fermented red rice yeast. It's non-fermented red rice yeast, and it's worthless. It doesn't work. It doesn't hurt you, but it doesn't lower your cholesterol at all. You can still get fermented red rice yeast in Canada. You can get it online. And somehow the naturopaths in town get fermented red rice yeast as well, so you can get it through a naturopath. And so fermented red rice yeast works, but you have to treat it like a statin. There are some people that are completely intolerant to statins that can take fermented red rice yeast, and I have many patients on fermented red rice yeast that have not tolerated statins. But just know that it can cause problems too, and the stuff that you're getting in the store here is a waste of your money. That usually gets a little bit.
It's expensive.
And I don't know how much it costs.
Doctor, excuse me.
Yeah.
What is the word you're saying? Statin?
Statin drugs, we won't get to that. Those are the prescription cholesterol medicines we'll get to later. So, but anyway, red rice yeast fermented works. Niacin, I have a bunch of slides on that, and fish oil. I think I have a couple slides on fish oils too, and those work. So